Welcome to Dental Business RX. Practice success in 30 minutes or less.
Thank you for calling ABC Dental.
How important is prior dental experience when it comes to hiring a new team member for your dental practice? And to be clear, when I'm talking about no prior experience, I'm obviously not speaking about licensed providers, dentists, hygienists, FDAs. I'm talking about positions that don't require any type of a license, an administrative position, a management position, or in some states or areas, dental assistants. Well, how important experience is really depends on who you ask. Some find it critical, while others are completely ambivalent and just looking for a bright, ambitious individual that they're willing to train from the ground up. And the funny thing about this, though, is who is experience actually important to? Who is it actually important to? From the perspective of outcomes, I'll tell you point blank that experience is a nice quality, but it's not even in my top 5 criteria when selecting employees because it has no bearing on whether this person is actually going to make it or not. Someone may have experience, but how good is that experience? Maybe it was a terrible experience. You ever hired somebody who gave you all types of trouble following some of your policies because that isn't how they did it at the last office? Yeah, well, how great was that experience? So while you might find it to be a key criteria, its actual important isn't all that great. It's no guarantee that you'll retain an employee or that their performance will be better in the long run. Now, add to all this that we're in one of the tightest labor markets on record, at least when this podcast is airing, which means coming by employees is more difficult and even more so finding ones that have prior experience. So having the ability to find, hire, and train anyone, regardless of prior knowledge of the dental field, is at a premium right now. And it may be the difference between whether your practice grows or contracts. So what does it take to get someone with zero prior dental and turn them into a successful, productive, and long-term employee? Well, that's what I want to talk about in this week's episode. My name is Jeff Bloomberg, and I'm your host, and I'm joined by Jeff Santone, the new client executive here at MGE. You may have heard from Jeff in prior episodes where we covered key performance indicators, more about the reception position, as well as how specific metrics to keep for case acceptance. And Jeff is uniquely qualified to speak to this issue of hiring people with no experience because for 10 years, Jeff owned and managed an oral surgery and a general dental practice in the Washington, D.C. area with his spouse. As a matter of fact, when he came on board, they went from doing about $50,000 a month to over $260,000 pretty routinely in short order, so more than 5x. And over 70% of the employees Jeff hired had no experience. So he's very uniquely qualified to talk about that. He's going to give you some great tips. I think we have you all set up over there, Jeff.
Yeah, I think I'm all good. Can you hear me all right?
Yeah, we're all set.
Great.
Okay, good. So I think I mentioned you hired about 70%. Like what would that work out to in numbers over time?
Over time.
Yeah, if you had to guess.
If I had to guess how many people came through the doors and how many had moved on.
Over 10 years.
Over 10 years. Geez. Well over 30.
Okay. So,
yeah.
So of those, those were with no experience.
Yeah. We'd have guys come in, no experience whatsoever. And then they move on. A husband or spouse had to go somewhere and start over again,
Fair enough. And then what about, if you had to rank, like in your mind, who were the best performers you guys had in that office?
Yeah.
If you could think of the top 3.
Top 3.
Okay. How many of those 3 had prior dental experience?
One.
Really?
Yeah.
So 2/3 did not.
Yeah. No, we made them.
Interesting.
Yeah.
And what positions did you guys hire with no experience?
Everything that didn't, we were in DC, so we were kind of, DC, anybody who's listening was, and I'm not sure if it still is, was a little bit of the Wild Wild West. They kind of were pretty hands off with licensure and requirements. It was only later, I think in 2015, did they force licensure, X-ray licensure for your dental assistant, but they also grandfathered anybody in that was already hired and didn't need to go through that process of a training degree. So we were quite lucky. So
if I was I wanted to be a dental assistant, I didn't have to have an X-ray license till 2015.
Yeah, I believe, yeah. I mean, we were in the surgical side of it at that time, but it was true for our surgical assistants. They needed no X-ray licensure at the time, and then they required it, but they grandfathered in anybody that we would have signed off on.
Wow.
So it was a little bit different, but because of that, we found the ability or no need really to go out for experience. We were more than willing to train our own.
So you would bring in addition to financial coordinator, treatment coordinator, receptionist, et cetera, you're hiring dental assistants and surgical assistants. They've never been, other than as a patient, they've never been in a dental practice.
Yeah, they've never been in a dental practice. And
so now, not to sidetrack here, but we want to give the people listening like some ideas because I find this fascinating.
Yeah,
especially with a surgical assistant.
Yeah,
because that's demanding.
It is. It's really demanding, and it got that way because I remember doing the interviews, and it leads us maybe into how does it work. But maybe I won't jump the gun. So
sure.
Let's.
Well, what I wanted to ask you is, so if you hired a dental assistant, and maybe they were working at Nordstrom or something before, like if you can think, where was one working before they came to work for you at the oral surgery office?
One of our surgical assistants.
Yeah.
Trying to think which. Maybe I remember one, a coffee shop.
Okay, so a coffee shop.
Yeah.
So he or she comes in.
Yeah.
And she's going to come working for you now. So and they turned into a good assistant?
They actually started as a scheduling coordinator, but loved sitting in there and watching. We then had her in oral surgery. There's head holder.
Yeah.
And then, which is, if anybody which doesn't do much but hold a head. And then, but she was really into it. And I remember, Dr. Lee being like, "Oh, maybe you'd like to learn about assisting," and that's kind of how it all started. And
so, how did you train her? Because you trained other people right off the street, right?
Yeah, we trained them right off the street. We trained our surgical assistants right off the street, and really, it didn't matter what assisting they said they had. I just remember. Where we kind of got this idea was early on, Virginia was just kind of like fed up with like these guys that are coming in, they don't know surgical assisting.
Got it. So these are the trained assistants coming in.
They don't know it, and like she wasn't like, I don't want to be like any surgical assistant who's listening, like, oh my God, that was a typical oral surgeon.
I know she was very demanding.
She was very demanding.
I remember.
Yeah. And you have to be because there's IV sedation and it's, you're practicing all those emergencies and all that stuff, airway and blah, blah, blah. So I just remember I was like, well, you know what? Why don't we do this? We're not finding anything good. Can you make me a tray, a standard tray setup, label it all, and I'll make a quiz out of it for our potential hires. Right.
Okay.
So this started then the training process
So this was part of the hiring process.
Yeah, part of the hiring process.
So the doc put together a tray.
She put together a tray.
Labeled it all. Did you take photos of it?
Took photos of it.
Okay. And then how did you do this quiz?
So then what I did is I had a piece of paper with the tray and I removed all the instrument names from what she labeled and I put numbers next to them and I said, name the instruments. You're in surgical assisting. This is a standard surgical setup.
But did they get a chance to know what those names were first?
These are guys who were trained.
Okay. This is somebody coming in. I've just come from
I know.
office.
So this is how this all started because like what I started to find out is that they don't know this anyway. They get 30% of it right at the high end of it, right? So I was like, well, this is stupid. Why don't if they don't know the tray. She could train me to learn this tray and I could set up a tray and I could be a pretty good surgical assistant. So I was like, oh, okay. So then that was the next step. I was like, okay, listen, Virginia, I want you to take a picture of every tray setup that we got.
Okay.
And label it for me.
Did all those?
All of them.
Took a photo,
it was maybe about like 8 or 10, depending on the procedure.
Sure.
And now I was like, oh, okay. So then I could get somebody in who's not squeamish to the sight of blood, which was actually requirement number one.
Of course.
I can't tell you how many people passed out.
Right.
Oh yeah, I'm good. And Virginia's catching them as they're passing out and putting them into a recovery chair in the middle of the procedure.
That was a no.
That was a no. And so that's how it all started. And I was like, great. So if I have a tray set up, and that was like the setup process. Like there's always a lead assistant in the room and there was always like somebody else. The head holder was like the person who was like.
That's the trainee.
Yeah, the trainee. But the trainee then is setting up the trays for the day. So that was like this graduated process of it all. I was like, great. So let's get a guy in. Let's teach him how to set up trays, what the instruments are, and then we quiz them.
Okay.
Right. So then I'd give them, the tray setup, right? So yeah, I know that, and they get it right.
Okay.
Then I'd throw a bunch of the stuff in a random pile, and I'd be like, now put a tray together. Show me surgical tray 1.
And this is a person who was working at Starbucks or Costa Coffee or whatever.
Yeah.
How long ago?
Yeah.
2 weeks ago?
2 weeks ago, 3 weeks ago, right?
Okay.
But very motivated. Loved it. Like
of course.
really loved this aspect of being in there and helping. Was like blown away, you know. I remember this girl because her head would always get in the way. She'd want to see what Virginia's doing, right? She'd be like, what are you doing? She's like,
she
okay.
was really into
she
it.
was really into it, you know. And so, but that picture of the trays and the instruments is really what started it all. You know, the rest of it, you know, how to break down a room, how to use a sterilizer, sterilization technique. I mean, that's all stuff, you know, that you can learn. That's after the fact, and we can fix that and we can make sure everything's going right there. But the gist of the surgical procedure itself, or being useful as a dental or surgical assistant, really required knowing what the instruments were, how to set up that tray properly. You know, there's a lot of times your dentist or your surgeon's asking you for that instrument specifically, and you better know what it is and how to hand it to them. So that's where it all started. And it was just like the hiring process led me to the fact that Virginia was right. I didn't believe Virginia. She's like, these guys don't know what they're doing. These trained surgical assistants aren't, you know, blah, blah, blah.
So these weren't just dental assistants. These were surgical assistants.
Yeah, these were surgical assistants. And so I was like, come on. These guys interviewed great. They're super nice. And they were nice. There was nothing wrong with that. But then when I started quizzing people, I started realizing, oh man, she's kind of right. She doesn't really know.
They don't know what this stuff is.
No. So then I was like, well, if we could do this for, let's say, you know, we'll call her Michelle, then we could do this for anybody.
I see.
You know, why not? And even take somebody who is kind of just getting into maybe dental assisting or doesn't know if they want to get into it or surgical assisting, and really make them into a really superstar surgical assistant the way you want them to be a surgical assistant, not the way they've learned in 10 other offices and picking up all those bad habits.
So what led you to it was the idea that the people who were coming in with experience knew only 30% of the instruments on a basic tray setup for 8 different procedures.
Yeah.
So then it was like, if you can teach that, you can teach anybody this.
Yeah.
Got it.
Yeah.
What was some of this? So then things like, how would you teach sterilization as an example?
Well, that is kind of the way we would teach sterilization is almost the way we would teach any other position in the practice. Virginia used to have this saying. She used to love saying it, you know, Maryland and blah, blah, blah. University of Maryland, where she went to school. She used to say, like, see one, do one, teach one. That's how she teach all of her staff in the back. And her staff were hers, her surgical assistants. So she would let them almost apprentice and watch what you're doing, explaining why you're doing it. Of course, the sterilization manual is there as well, what to do, how to do it, right?
But now, can I ask you a question? Because this is something that's really out with people.
Yeah.
Did you require your assistants to read the sterilization manual?
Yeah.
Okay. Now, this is the manual for the machine itself, too.
Yeah.
The autoclave.
Yeah.
Okay. Very few people actually do that.
Yeah.
Well, and it's funny because you'll see it in an office type setup. There's a copy machine and there's a manual for the copy machine.
Yeah.
And I've seen some companies or organizations that require people read and understand the manual before they're allowed to use the copy machine.
Yeah.
Well, think about your car. How many people actually read? I read the manual for my car. It was great. It did all kinds of things. I had no idea.
Right.
But like, there's a reason that thing came with that, whatever it is.
Yeah.
And people don't read it and they wonder, why is this not working?
Yeah.
Yeah. Anyway.
Yeah.
Thought I'd throw that in there.
And even manufacturers know that. What do you get with your car now? A quick start. Because they know you're not, maybe you're not the guy that reads the book, but you'll read 2 pages.
Right.
Right.
I read the whole thing.
Yeah. And
I know what the PSI at certain temperatures from it. No, I'm kidding.
But all of them knew him in the back. Right. Yeah. So, you know, Vince, who was in charge of some of this stuff, I remember, you know, because we read the manual on the sterilization machine. I mean, these are buildings, right? They're 70 years old. So we moved sterilization from one countertop to the other countertop. And there was too much of a slant on the one countertop. It wasn't as even. So the water level was different. So sterilization wasn't working.
I see.
So we had, you know, thank God we read the manual. You're like, you got to level this out. You got to put this up. And that's how you get more water in there. So the sterilizer works.
Interesting.
Right. But you knew that because you read the manual.
Interesting.
Right. You don't have to call out Henry Schein to be like, okay, you guys are idiots.
It's called a shim.
Just you know, you see these legs that
they adjust.
They adjust. That's why. $200. You know.
All right. So that's how it was applied in the back.
Yeah.
How did you apply this in the front? Or I know you guys had a PR director.
Yeah.
I think you had an internal and external PR director at one point. Somebody who was relating to other GPs and somebody who was going out to talk about all on fours.
That's right.
But how did you train your front desk people? What was sort of your process?
Yeah. And to that end, I don't I don't think we directly hired some of those, what we would consider higher level positions. Everyone at our practice, by the time, 5 years had rolled around, 3 years had rolled around, everybody who was anybody in that practice was probably the receptionist at some point.
Okay, so you brought them in at reception.
Yeah.
Did they handle, because we've talked about not having them handle new patient calls right off the bat. You had a new patient person.
I was probably handling new patients in the beginning.
Got it.
Right. But then as the receptionist, I always tell this to everybody. A receptionist is the most turned over position for two reasons. Number one, they're really good at what they do.
Right.
And I'm going to put them somewhere else.
They're getting promoted.
Yeah. Number two, they're not very good at what they do and they're fired,
right.
Or they get let go or they quit on their own. So we had this proving ground of the front desk, which most people do too. That's where they're going to put most people. And as they did better, we put them into these other positions. And I joined the dental practice not knowing anything about dentistry.
Yeah, I should mention this. I've been meaning to mention this.
Yeah.
You started with zero experience.
Right.
And, we've had clients who have come from Wall Street or, we had one client as a bank manager who manages 3 of his wife's practices now, and one came from Wall Street that manages, others have come from other industries. Now, Jeff came from, actually, you were an economist at the Federal Reserve.
Yeah. It was,
It's like, I don't know if anybody would have guessed that one.
Heyday of it all.
You weren't responsible for any of what's going on
No,
now.
I didn't do it. No, that's not my fault.
You have nothing to do with interest rates.
No, it was the banking crisis of 2008. That's where, we were, I guess it was.
Well, you were out by then.
I was just starting to leave. Like I was almost out. Like when it started all
Good time
crash.
to go.
Yeah, it was a good time.
Okay.
But I didn't know anything. And it takes us back to that question. So you asked, what would I do for the front desk?
Yeah, so let's say I'm your new receptionist. I have zero experience. What is my first day going to look like? What's my second day going to look like? How are you going to know I'm doing a good job? What type of stuff would you throw at me?
Yeah. So what happened was everybody at a practice who is short-staffed or knows they need new staff, and I'm no different.
Sure.
What you hope is that you bring somebody in and they're going to lighten your load.
Sure.
And kind of like set it and forget it. Mm-hmm. Like I got this guy, they can do it. Boom, I'm gone. Right.
Sure.
And then inevitably, it doesn't work out.
Sure.
And then you're still doing it. Okay. So by the time we were, MG clients and I'm starting to learn all of the process of running your organization. And I realized, through the training that it was like, look, if I'm ever going to get rid of this thing, then I better do a good job of writing it up.
Okay.
If I really want to do this right. So very lazy, just,
okay. No judging.
No judging. Yeah. We could call it efficient. So what I decided to do, I was like, look, I'm tired of answering phones. I don't want to answer phones. And the phone system that we had, they can get quite complex. Mm-hmm. How to put somebody on hold, where to park them, how to pick it up, how to transfer it without having the person on the line, how to transfer it without, it's like a nightmare. And now that's a manual that I did not want them to read. Mm-hmm. It was just too much. Okay. It was like insane. So I was like, okay, great. If I'm going to get somebody to help me out answering phones and being productive and knowing what they're doing, then I better have them really ready to do what I do. Mm-hmm. And the only way to do that was to create what I called like a little mini manual on this phone.
Okay.
What were the most important parts of using the phone?
Was this like the first work you created, so to speak? So so you could put me on the phone, I read this manual, and what are the important points to know on the phone? Yeah. You showed me how to use it.
Yep.
And how long did that take normally?
So here was another thing. If you could not get through the manual in like 30 minutes, it might, it was like a page and a half.
Okay.
And most of it was pictures.
Okay.
It was like, this is the keypad. This button you press here to do, you know what I mean? And so if you couldn't get through in 30 minutes, then it was sometimes an indicator that maybe you're not going to make it. But most people made it through in about 30 minutes. That's part. So now I go, you got all that. I go, great. Then I drill them at a specific set of sequences. I would say, okay, show me how to pick up the phone. They'd be like, okay, great. Show me how to put somebody on hold. Show me how to transfer it. All right. Show me how to put somebody on hold, pick up the phone again, put that person on hold. And now there's nobody actually calling.
So this wasn't off the cuff. You had a whole list of stuff.
I had a whole list of stuff that I would do with them. And some basics. I'd be like, great. You feel comfortable with that? Like, yeah, this is like so no brainer. I'd be like, okay, good. So now you're going to sit next to me. Mm-hmm. They don't even let them pick up the phone yet.
Okay.
And so for like a half a day, I'd make them sit and watch what I'm doing and how I'm doing it. And I could look, you can help greet people and here's some paperwork you're going to hand to them today. But I want you to watch what I do and how I do it. And there's a lot of phone calls coming in. Good. Okay. So then And then I'd start going, okay, good. You got all that? Yeah. They're like, okay, we're going to start picking up the phone now.
Okay.
Right. And then I go, I'm not going to pick it up. You're going to pick it up. And you're going to pick it up. And I'm going to watch you and I'm going to listen and I'm going to be here in case you run into any problems and I'll help you push the buttons if you get overwhelmed and da, da, da. And so I did that and I would do that for a couple days. I'd sit next to them until
while you're doing your work and they're answering the phone.
Yeah. And I would also help do the overflow, whatever happened. Right.
Okay.
And so I'd do that for a couple days and that would basically be it. Then I'd let them go. And I might do my work out there for a while.
Not let them go fired. Let them on their own.
Let them on their own.
Okay.
Now they're on their own. Training wheels off. Good. Good. Then once I thought they were really comfortable, I'd do some crazy stuff every once in a while. I'd have the whole team like get out their cell phones and call the office like one after the other.
Oh gosh.
We had 8 lines.
Uh-huh.
So I was like, okay, good. Let's see how, they're doing. No. Can they handle all this? 8 lines. Now they kind of knew the test was, I told them there was going to be some tests, And that's how I keep testing them and moving and pushing them through to get really comfortable. And it is a comfort issue when you're handling that many phone lines and you're trying to, put people on hold, put people through, take a message, grab the person who's coming in. And we were lucky at the end. We had 2 full-time receptionists.
Well, you guys had a lot of traffic because I think also when you say reception to the average doctor listening, let's say, they're thinking with the person who's scheduling patients.
Oh yeah, no, we had a
your case. It was a true reception.
Yeah, that's all they
did. You guys
did.
had a beautiful office, like a really nice reception area. People would walk in. This is the person greeting people, giving their paperwork, answering the phone, and then if someone called up to schedule,
they went to the scheduling person.
Right. So now here's, I guess, my next question. So you've done what were the other forms of reception training like that?
Yeah. They were all kind of, we had what we called like a mini training pack, the things that you had to know and were completely essential to day one. And then you had a little bit more of an advanced training pack, like, okay, like now you're fully grooved in on the essential basics which is the most important, handling that. Here's your full rest of your, duties and responsibilities and how we're going to handle that as on this position that you're in.
So let me ask. So it was a page and a half on how to use the phones. Did that include how to greet people when they called, or was that just the phone system itself?
Yeah. In it were, because it was assuming you're picking up the phone. So the one script was in there on how to answer the phone.
Got it.
And I had to drill them on that, like make sure they said it. And they have to say it a few times before they really.
Right, become second nature.
Yeah. So that script was in there, but that was it.
But that was a page and a half.
Yeah, that was it.
So how many, to fully train your receptionist, you go, this is a fully trained receptionist.
Yeah.
How many pages of material was it?
Total, possibly, if I remember, it was like 13 to 15. It wasn't like a ton.
So this isn't something that's going to take somebody 2 months to write.
No.
If you put your mind to it, you get this done in a day or two.
And a lot of it is pictures.
Things. Okay.
Yeah, and like attachments and handouts,
Got
like
it.
things you got to fill out, So it was pretty straightforward. And I thought, for me, what it did was it gave me that knowingness that I could let the person go. Like I wasn't thinking
they could just roll now.
Yeah, like not let go. Like I could put them.
We're talking about personnel.
Yeah,
here.
I could let them be on their own. I could go down, sit in my office. I knew they were going to get it done.
Got it.
And I wasn't second guessing and wondering.
So let me ask this. You're expanding. Things are getting busier. Let's say I've got this receptionist job. I've studied all 13 pages.
Yeah.
And what I like, it's sort of, you broke the process down into 2 or 3 parts here. It's one is the actual study.
Yeah.
So the person has to study what they're doing.
Yeah.
It's very easy to understand and comprehend. And then you actually drilled them on it.
Yeah.
Like role played.
Yeah.
And then you actually apprentice them. So they watch you.
Yep.
Then you watch them.
That's right.
And it's like that's the 3-step process. So
Yeah.
materials, role play, they watch you, you watch them.
Yep.
Right? So you've done that with me, let's say.
Yeah.
I'm up and running and functioning as your receptionist now, and that might take a week or 2, I imagine.
Yeah.
Okay, and then the office is expanding, so now we need a scheduling coordinator.
Yeah.
Am I going to most likely be moved up if I'm doing a good job?
Yeah.
And we're going to do the same thing all over again with a new receptionist. Yep. But now I guess what's cool about that is you can do the whole apprenticeship thing.
Yeah.
But I could also help.
You're probably, at that point, I would have then made you apprentice the person who's going to take your post.
That makes sense.
Yeah.
You might do the tests, I would assume.
Yeah, I might do the test. I might check them out. But it was like, okay, good. So Jeff, this is Mike, and he's coming to help out at reception. He's going to be the new, receptionist here until you get fully settled in on scheduling. So I want you to do exactly what we did. And I would then have you go through, okay, this is the mini hat, the mini training pack. This is, you're going to watch me. Good. And now you might come and give me reports and be like, this guy ain't going to make it. Yeah.
But what I love about this,
yeah.
is so I'm doing, you got me through their basic training.
Yep.
I'm apprenticing them.
Yep.
You don't have to schedule and I've already learned how to schedule, I guess, by now.
Yeah, you would have, because you're using the system every day.
Got it.
Like you're in EagleSoft, you're in Dentrix, you're in Open Dental, and what you and I, I'm not trying to date myself here, but like we were right at the beginning of generation like gaming technology, right? Mm-hmm. Like we love it. Well, like the kids that were coming in, and I call them kids, I mean, they were born with like a computer into the side of their head. I mean,
right.
I showed them a software system and they'd be like, okay, good. So I got that. And I'd be like, you understand EagleSoft? And they'd show me ways to get to reports I didn't even know how to get to.
Right.
They're so quick in the practice management software. It was so easy to just say, okay, good. So here's our scheduling policies. Right now, you're going to sit back here and I'm going to either apprentice you or you're going to be sitting with, because remember, let's say Michelle was my scheduling coordinator who I made a surgical assistant.
So Michelle could apprentice the schedule
right.
coordinator, the schedule coordinator, the new receptionist becoming the. So this is great because then it doesn't require your butt in a seat for days doing this. They're doing it as they're turning over their job.
That's right.
Then they could go apprentice on the next post, or maybe they've already done that.
That's right.
This is, it's a replicatable way of growing that doesn't require your day-to-day active participation.
It just requires that you've written it up. And see, that was the biggest thing I learned at MGE. It was like, look, why am I still doing this? Because obviously you didn't write it up. If someone's still coming to you and asking you how to do it, then it's not in the pack.
So you learned that on the organizational training on the Power Program.
That's right.
Yeah.
So that was a big step.
Yeah. So I'll put, by the way, if you have questions about the Power Program, the training Jeff's talking about, I'll put a link for it on the episode webpage.
Yeah. I mean, that was huge. And every once in a while that didn't happen, Jeff. Mm-hmm. Like every once in a while as an office manager, I'd have to pop my butt in a chair and apprentice again.
Or if you lose a bunch of staff
or you lose a staff, or if I lose a scheduling coordinator and the receptionist goes, I don't want to do that.
Right.
I'm more interested in, I really like what the PR person does and talking to people and getting reviews and getting more people. Okay. Or I really like the breakdown of benefits. Can I mainly focus on the insurance part of it? So, okay, that's fine, So, it still happened that I'd have to do it once in a while.
Sure. But you guys, I met a lot of your staff. You built a great staff.
Yeah.
And had a nice, had a good company culture there, which was cool. So, obviously what you were doing was working.
Yeah. And that's a great point. Because every day we talk to doctors, we're on the front end here. I've been lecturing for MGE since 2012.
That's true. You have.
Right.
Off what you were even doing while you were managing. You'd leave town for a day or two to go do one in California or Chicago or whatever.
It was awesome. Yeah. And, but it's come up more than it came up in the past where they're like, how do you find good staff?
Right.
And what I try to explain to doctors is that there are great people out there, but you have to make good staff. You have to create great staff.
Yeah, they're made. They're not, they don't grow on trees.
They don't grow on trees. And if there is a great staff member, you're not going to get them. Mm-hmm. Like it's blind luck that, Susan, who's an unbelievable office manager out in Tacoma, Washington, whose husband's moving now to Norfolk, and you're going to pick her up. Like that's like 1 in a million, right? So you're going to have to compromise on this completely arbitrary idea that I need people with this training and understanding of a dental practice.
Yeah, you have to train them yourself.
You do have to train them yourself.
Which is funny because the way I was going to end off, I was going to ask you. So I'm sitting out here listening, and I've got a bunch of open positions, and I'm holding out for that, perfect schedule coordinator.
Yeah.
Should I wait till I find one, or that's kind of a dumb question. I guess I should just go hire somebody.
Go hire somebody.
Well, and there's a lot of, if you look at, you might take somebody in customer service, or someone who worked in a department store, or someone who was in sales. Or
we loved it. I would, Virginia loved shopping, and we'd go to the mall once in a while, and we'd be at, you'd be walking through Nordstrom at the makeup counter, and there was someone that was really nice. Mm-hmm. We'd hand them a card and come in. You ever thought about doing something in the dental practice, or, a waiter or waitress that seemed really on their game? You're like, here, like we were competitive in pay and bonuses. And so we knew that, like, if you were thinking of changing, doing something, it's like, okay. So we had no qualms asking people that just seemed really nice and had that customer service aspect to them, because I could train the rest. That was easy. But that starting point of, you're a great person or you're really nice or you like other people, which surprising, funnily enough.
Not everybody does.
Yeah, you call some offices and it's clear, like maybe this person doesn't like people. So I never got stuck on, where you worked or how much experience you had or, because then it was a recipe for just turning my back and a blind eye to it, which then you think you got it done, right? Like, oh, that guy's got it. And then meanwhile, you're missing $300,000 you've been embezzled against.
Right, because they haven't had experience with you and you don't know what quality their experience was. It's kind of silly.
It's very silly.
Okay, cool. Well, Jeff, thank you so much for coming on this week.
Yeah.
This is awesome.
Yeah, thanks for having me.
Yeah, so again, if you're out there after listening to Jeff, if you need to fill a position, just hire somebody. Again, and learn how to train them.
Yep.
And I've put a link to the MGE Power Program. Like Jeff was talking about the training he did as an office manager. It's on the episode webpage. You can also find out more about us here at MGE at mgeonline.com or call us at 800-640-1140. And Jeff, if anybody has any questions like this out there, do you mind if they give you a call?
Give me a call. Totally fine.
Call the main number I just gave, or you can also email Jeff at Jeff, Jeffs, as in Sam, at mgeonline.com. Cool? Okay, that's all we have for you this week. Have a great week, and we'll see you at the next episode.